Welcome back to the SA Morning. Now, it seems that year-end burnout has now come earlier than usual this year, and dedicated employees are said to be the ones mostly affected. Now, experts say there's been a spike in mental health distress and an early increase in work-related fatigue. This is linked to anxiety about year-end demands as well as stress remaining from the COVID-19 pandemic. Dr. Sandile Mhlongo is a health economist and managing partner at Curis Health Solutions. Now, he joins me now to discuss this even further. And Dr. Mhlongo, thank you so much for your time. A very warm good morning to you. I think if we still refer to COVID-19 as a pandemic, even in 2023 and the lockdown specifically, Doc, are we still saying that you're still seeing, sort of like symptoms from the lockdown in as far as mental health is concerned?
Morning, Tumelo and the viewers. Absolutely. The pandemic and its effects will have a long-lasting impact on our lives, particularly when we talk to mental health. So a lot of unresolved issues, a lot of poor, and it shows actually the dysfunction within also our healthcare systems, in that actually we haven't really managed the pandemic effects on mental health, and the lack of access to resolve these healthcare services means that people actually have unresolved chronic stress and chronic fatigue that's resulting from the effects of pandemic and the anxiety that actually it caused on us.
Absolutely. And I mean, I have to agree with you, Doc, that it almost seemed like, we just moved on from the lockdown. I mean, families were separated, loved ones were lost, jobs were lost. There was a lot of recovering that had to be made, and we just kind of moved on without necessarily addressing the issue and consulting. But let's talk about what that effect and more has now on our current, stress levels. It's October right now, Doc, but surely year-end anxiety as well is crippling in as those demands seep in before we close off for the year.
Absolutely. And I mean, I was just reflecting on how the box also added to my anxiety and stress last night. But again, just congratulations to the box.
Yeah.
But absolutely, as the year is dragging on, there's this anticipation of, a break that's upcoming. And of course, work pressures have been high. The economic situation in the country and globally, in fact, has not been as positive as we would have expected or liked. So we're seeing that actually, people, particularly just to confine it to the workspace, a lot of companies during COVID actually laid off people. And so that creates anxiety for any worker.
Yeah.
That, am I going to be next? What's going to happen to me? Is the company going to survive? So those type of anxieties, especially if unresolved, unmanaged properly, they create, effectively even clinical conditions like post-traumatic stress disorder. They could lead to depression or clinical anxiety. So as you said, we moved on. We didn't really provide sufficient services or help to people who didn't effectively manage it. So what we are actually experiencing now with the year tiding down is that with all of these chronic stressors affecting our lives and our personal spaces as well,
right,
with the demands of school, for those who have kids and so on and so forth, and other family stressors, if they are not managed adequately, they lead to fatigue, they lead to burnout, and they eventually lead to clinical diagnosis, as I mentioned, depression, anxiety, PTSD. So that is an impact of, as I want to emphasize, chronic, unmanaged and unresolved persistent stress.
Absolutely. And I think it's often, a something or a condition, a symptom, a side effect that most of us are not even willing to admit to, Doc. It would have to take someone saying, Dr. Mhlongo, you're not yourself. You are withdrawn, for you to actually realize that maybe there is a problem if you're not at all in denial. But as you make your point, you also remind me of a concept of quiet quitting. Is this a time where we also see a lot of employees and workers just doing the bare minimum, just, quite quitting in a sense because of all the effects that they're going through? When you think about the cost of living right now, the shortage of eggs, I mean, it seems everything is expensive and going up except for your salary. So you may feel like, you're not doing much, improvement. You're not working towards something tangible.
Absolutely, and you tell me actually quite. I like the phrase "quiet quitting." The truth of it is that there is a detachment from work, and often it affects the very driven, the very dedicated, and the very the people that you really would least expect it from. So they actually tend to be detached from their work. They tend to feel emotional exhaustion, depleted energies. And it's not really necessarily a cognitive decision that I'm going to detach, but it's largely actually just lack of capacity, lack of resources. It's like driving a car that is an empty tank. It's not that the car doesn't work or the car doesn't want to go with you, but it does not have the resources. And the same happens for us. We have finite resources that allow us to cope, that allow us to function within society, that allow us to actually deliver in our workspaces. So we've got to actually separate that from just typical laziness. And I think your type A personalities, the very, very highly disciplined, highly dedicated employees are going to be the ones that are most likely to experience fatigue, year-end fatigue and burnout because of their constant sense of urgency that once the resources get depleted, they have nothing more left to do.
Absolutely. And just, as a way to suggest interventions or, I don't know, solutions, Doc, what do you suggest to both the employer and the employee experiencing what you've just narrated during this time of the year?
So the first part of it is actually like any healthcare intervention, it must focus on prevention. So we always talk about providing mental health resources and support to employees on an ongoing basis, not when things have gone wrong. So, for instance, we've got to appreciate that the remnants of COVID-19, of the COVID-19 pandemic in our lives still remain. The societal pressures, socioeconomic demands on employees are much higher than they've ever been before. The challenges of load shedding and the challenges of being in traffic for extended long periods of time, they still affect us. And of course, you mentioned something important, inflationary pressures, the cost of fuel, and so on and so forth. So if there aren't any effective mechanisms on an ongoing basis to manage it, you're gonna see employees quite quitting often.
Right.
So our advice to employers is have mental health services available on demand on an ongoing basis. The second thing I want to just emphasize is the ability to plan taking periodic breaks as opposed to waiting for year end to take the long break that we all look forward to. So take breaks along the year, sufficient rest where you can really completely disconnect. Not the break where I go away and I'm on email and I'm answering phone calls. A complete break and disconnection from work. And then the last thing is that when there are signs and symptoms, seek early help, speak to a therapist, speak to a psychologist where you can get, because it's really about providing skills and capacity to cope with ongoing stress. And we will always have stress.
Absolutely.
It's about how it is.
I appreciate that advice, and thank you so much for speaking to us, Doc. I'm sure when it comes to all the South Africans ahead of that final on Saturday, the advice is simply get a life cover. Just make sure that you are safe in as far as the Bokke are concerned for the final. But thank you so much, Dr. Sandile Mhlongo. A pleasure talking to you right here on the South African Morning. A health economist and managing partner at Curis Health Solutions. So make sure that you do regularly check in with yourself. Take some breaks, as the doc, of course, mentioned, as we all experience, I suppose, fatigue at this time of the year, some anxiety, stress levels quite high, but also make sure that you do consult with your therapist or psychologist, especially if you do sense that you might have been negatively affected as far as your mental health is concerned.